We know in clinical practice that patients will present with carcinomas that we cannot identify their primary site, or the so-called carcinomas of unknown primary site. In addition to that, there are certain ambiguous presentations where patients appear to have a certain type of tumor. However, the overlap of the presentation with potentially different types of cancer makes the initial diagnosis potentially ambiguous. Data would suggest that really the combination of carcinomas of unknown primary site and the ambiguous presentations probably make up that in combination, the 15%. And that probably amounts to somewhere around 100,000 or so patients newly diagnosed each year. So it's no small number. It is important for us to understand what the primary site is, because the treatment that we render is often dictated by where the tumor started, not where the tumor ends up. So a patient with metastatic breast cancer, for instance, would often be treated very different than a man with prostate cancer, even though molecular markers might overlap there, some of which, as I mentioned before, may not really be actionable even though present. So understanding where the tumor starts is probably and often more important than the molecular profile that we see.